Good morning, everyone. Welcome to this session. We are still on the second learning outcome, and I hope to end it today. And then we'll start the third learning outcome as well. So yeah, just a bit about what we were doing. So thank you, Tayo. So we were actually, we were trying and understanding uh, health and social care provision for different ages and stages of life. We had talked about the initial stages of life, okay, starting from infancy, and what the World Health Organization says about being healthy. And then these were the stages that we had talked about. Um, and then now we come towards the later stages of. So yeah, any questions, please feel free to ask. We had talked about this. So we were talking about early, mid adulthood. So what early adulthood is an extremely diverse period of life, and it has a wide range of lifestyle choices. So you make different choices based uh, on your responsibilities, your lifestyle choices. So some people they launch directly into adulthood, and the legal age is of 18 years, while there are others that make a much more prolonged course. And change is always stressful, whether it's related to a marriage, whether it's related to a child, any positive or negative thing. It doesn't have to be always a negative thing that is stressful. A positive thing can also be stressful, because you're trying and coping with it. So in a period of life that is full of change, there are many opportunities for stress and stresses. So these are some of the points that we are highlighting. So difficulty in coping with emotions such as anger, sadness, anxiety. We have alcohol and drug abuse. There's academic or employment difficulties. You have family discord. Just a minute. There's marital issues, difficulties in finding a romantic partner. We had talked about this earlier. Financial stresses. Just a minute, I'll mute you. So all of these components, they have their stresses in life, okay. um, and then this mostly takes place in adulthood and late adulthood. We had talked about we were about to talk about the support services. So we are considered in late adulthood when we reach our mid 60s until time of death, because we are living longer. So late adulthood is getting to, we get to it at a later stage. A 10-year-old child today has a 50% chance of living to the age of 104 years. We had talked about this, some support services that are there during late adulthood. Now we were going to what our next topic was, to describe the health and social care services required and provided at different points during lifetime. So we have maternity services where there's mothers to be, they're met with regards to their pregnancy tests, routine checks to delivery services, etc. Then there's child care support as services as well. And there are different ways where the UK government has uh, provide support for childcare, especially for working parents. Then there's adolescent services. We had talked a bit about CAMS, which is the service, which are services for child and adolescent mental health services. So it's a free run service by your local NHS, and it's made up of medical and mental health professionals. It is though free of cost, but there's a lot of workload. That is why it becomes difficult to reach those at times for some people. And this is known as home care or domiciliary care, or where you get care at your home. And there's medications that you can get support with. There's coping strategies that are there for people with mental health issues. And then it depends upon the person's abilities and the level of care and support that they receive. Children and young people with a learning disability, they may have special educational needs, which are known as SEN. So there's special support for them in schools, there's in colleges as well. So it helps them walk or catch up with the rest of the people of their ages. Then we go on to describe the health and social care services required and provided at different points during a lifetime. So there's end of life care, which refers to health care for a person that who's nearing the end of life or is an advanced stage of terminal illness. And generally speaking, people who are dying, they need care in 4 areas. That's physical comfort, mental and emotional needs, spiritual issues, and practical tasks. There are different services provided by the GP. There's preventative healthcare, and this leads to prevent. This is for prevention of the illness and to decrease the burden of disease and associated risk factors. There's hospital social care and mental health services. So, what is long-term care? Long-term care, obviously, is for long-term illnesses. So disability brings with us a lot of long-term illnesses and long-term caring responsibilities. That is why it is known as long-term care, as opposed to just a simple infection. For instance, if you would catch a simple infection, that's not long-term. But the sequel that remains after it, like for instance, if you've developed an infection of a limb and you get an amputated limb because of that, they've had to amputate it or to cut it off, that leads to further disability, and that becomes, from short term, it becomes a long term health condition or a long term it has long term care needs. Okay. um, and it's mostly the older age people who have long term issues, but now, because when it comes to the changes in dynamics in health and disease as well. So now people are getting those diseases which they were having in later ages, they're getting them earlier. Anyone, can anyone speak about why is that change happening? What is the reason for uh, having those diseases in younger ages? Can anyone comment on this? You can write it in the chat box also if anyone wants to contribute, because it's good to talk. It's good to have an interactive session rather than just the teacher speaking. Then we go on to explain arrangements for long-term care provision. There's care in the community. This is a strategic vision that is described in a healthier future, and the objectives are set out in the department's public service agreement. So what happens here, and what the key aim is here, is to support an increasing number of people in order to live independent lives, preferably in their own homes. So in order to do this, the health and social care needs to develop effective alternatives to hospital care, which is designed to reduce inappropriate admissions. So what problems do we have when we have unnecessary lengths of stay? So there are problems that the NHS faces because there are more resources that they have to spend on this person who probably could be doing better at home. And the other problem is to have cross infections. So if you have a bed and there's a person who's extremely got a lot of infections, for instance, and living in that same ward or staying very close to your bed, that means that that person can transfer their infections to you. They have a greater chance of doing that, and that can only be more harmful than being helpful to you instead. Then coming towards care in the community. So this is a strategic vision that is, so we've talked about this. So there also needs to be a focus on rehabilitation. So rehabilitation obviously is a long-term plan again. So, and there's reliance on residence and nursing home care. Now we go. Um, so domiciliary care, when we talk about that, that is mostly about people who live in care homes. Um, so when you're living in a care home, you're obviously you've got day-to-day other tasks as well that are domiciliary care, and there's personal care. There's other activities that allow to maintain your quality of life and in independent living. Um, so this, what is included in it, it's personal and uh, continence care. There's managing your medications, that's helping to mobilize in and around the home, household tasks, meal preparation. So they make you as independent as you can, um, but then even supporting you. Um, so there are people who are bedridden, people who need a catheter, and there's stoma management as well for that. Um, for people who do who have difficulties in or they've had a surgery where they cannot eat properly, so there's equipment that is attached to them that helps them in feeding requirements. You might be aware of that. And then we go on to explain the arrangements for long-term care provision further on. So there's institutional care or institutionalized care apart from domiciliary care. So this is the most common form of long-term care. Elderly and disabled people, they're able to interact together, and they have 24-hour care to daily necessities by professional, sorry, and this provides patients with a sense of security. Then there's institutional care, which is it's also there's also a type of residential care, which is known as institutional care for large groups of children. And it's characterized by a one size fits all approach, according to which the same type of service is provided to all children. And they don't consider their ages, their gender, their abilities, their needs, and reasons for separation from parents. Then there's this institutional care is usually provided by a large organization. It's mostly comprises of nurses, nurse practitioners, doctors, therapists, nutritionists, and many more. So within the UK, access to services throughout these provisions is done through either directly by self referrals. For instance, if you want to go to the dentist or the optician, through GPs or referrals, through the hospital, through private insurance providers, through social services, or through educational establishments. Now we go on to analyze the barriers to access to provision of different at different stages of life. What are those? So what are those barriers to accessing services? Some of them are regional, sorry, social, economic, and policy barriers. So there are many, many more barriers, but some of the main ones are these. So we'll go a bit about each one of them. So regional barriers. So some individuals, they live near the health and social care and early year services, and others that may live some distance away. For those individuals who are, do not live near the services, they may find that their buses that are um, not running at a convenient time, or there are different other problems that they have to face in regards to time or in regards to the places where they have to go. Um, and then there's some individuals that may find their mobility problems to be too much and they can't reach that place. Again, transportation, there's a lot of other issues also which they have to face, along with the other problems. So the research shows that, studies show that it has a great impact if you're living close to obviously a hospital, a care setup, or even like when your schools are closer, your places for work are closer, it becomes easier for you to access those services. So now we come to social barriers like isolation or debt. So psychological barriers. So this barrier affects the way an individual thinks about a service. They may have a fear of a dentist. If an individual feels unwell, they are and they but they're worried about finding out what is wrong, and they may not seek help from their GP. Then there are financial barriers. So to do this, how much does it cost to access, for instance, any health service? If um, if if the health, social care, or early years services is existent, the individual is trying to access and is some distance away and may not be able to afford the transport cost to get there. So if a patient has to pay for medical prescriptions, they may not be able to afford it, so they do not get so they do not get the medicine that they need. And then going forwards, so there are a lot of barriers that where we face on a regular basis and we may not realize them. Then there's economic barriers, such as the resource barriers. Sometimes in the health and social care and early years services, an individual needs to access and may not be available. So they have to wait until there's sufficient time to pay for all those that need a service. Also, there may be a high demand for vaccination against a disease, and there is not enough vaccine available for those that are in need. So there are a lot of problems. So there's a huge demand. Um, so people have to wait. This happened for COVID-19 as well, and it's happening at the moment for a lot of other services as well. Then there's policy barriers. So several policy barriers need to be overcome if integrated systems, care systems are to be established more widely. So policymakers should explicitly recognize the need for completion in some areas of care and collaboration in others, and should develop competition rules accordingly. Talking about the possible ways barriers can be addressed. So there are regional barriers. So transport is provided, house visits are there, pop-up clinics are existing. Um, you can there are ways where these barriers can be addressed. Sorry. Then there's social issues can be overcome to introduce buddy system, for instance, where patients can access services with a trusted person and explain the steps of procedures. There are different resources like vaccinations on a needs basis and giving it to the most vulnerable first. Then there's policies, so adapt policies to reflect current needs and requirements and adopt a person centered approach. Okay, so these are some of the points that we have covered so far. These are your references. I'll quickly jump to the learning outcome 3. Just give me a minute while I upload it. I would appreciate if you all could start writing your names. Who've done that, thank you for them. Um, but if you've not done that already, please start writing your uh, names in the chat box. And I'll take your attendance at the end as well. So I'll start sharing my screen now. Just a minute. Yeah. Thank you. So now we talk about the third learning outcome, which is to understand the different areas of specialism within health and social care. Okay, so what are the different sectors in health and social care? So there's primary care, we have secondary, we have tertiary care. Uh, so primary care is often the first point of contact for people who are in need of health care, and it's usually provided by professionals such as the GPs, you have dentists, you have pharmacists. The NHS in England provides care that's free at the point of use for almost 56.4 million people. There's secondary care, which is also referred to as hospital and community care, and this can be managed, planned. So it's elective care, such as cataract operation or urgent emergency care as well, such as a fracture, treatment of a fracture. And then there's tertiary care, which refers to a very highly specialized treatment. So you have neurosurgeons there, you have transplants there, and secure forensic mental health services. Now we go on to analyze the different specialist areas within health and social care. So it's quite complex. So we have, but they tend to work together. So there's pediatrics, there's geriatrics, there's maternity care, there's mental health, social work. Um, so pediatrics, for instance, it's obviously, as the name suggests, it's more to do with children. And there's community-based pediatrics, there are general pediatrics, which are hospital-based or subspecialists as well. As you can see, that you can have endocrinologists and diabetics, there's neurology and nephrology, neonatology, which deals with children who are very young, neonates, less than 1 month of age, respiratory medicine, pediatric intensive care, and the list goes on. So, and there's this as well. So oncology, for instance, there are cancer specialists, and it's a whole mix of specialists and subspecialists. So where now we go on to analyze the different specialist areas within health and social care. So when we talk about geriatric medicine, it is the branch of medicine that is concerned with all the aspects. So they deal with all aspects in health, that happens in older adults. It's the largest medical specialty because of the reason we have this happens because we have a greater geriatric population. We have a lot of older people in the population right now. So they work in a variety of settings, just as pediatrics. So they can work as hospital doctors, social workers, families and carers can be there, supporting for families and carers. They can be involved in diagnosis and management of acute illnesses and chronic or long-term disabilities. Common procedures and interventions that they are involved in are, they help an older person in managing their mood and cognition, their gait, their nutrition, fitness for surgery, physical exams wherever there's necessity, assessing a patient's suitability for continuing care in the NHS or community, assessing the outcome of rehabilitation. So then there's maternity care. We know a bit about this. So a maternity support worker is at the front line of a family's journey through pregnancy, childbirth, and the first few days of birth. And the role is to help care for mothers and babies, making routine observations, and they update records and other admin tasks, educate parents on a one-to-one basis or in groups, take blood samples, prepare equipment, and promote breastfeeding, report problems to registered midwives or nurses. And they work in either the community, postnatal wards, they can work in maternity theaters, involved in surgeries, delivery suites, or midwifery led units. Mental health, as we talked about, it has a huge impact on your general health, and it's a long-term health concern. So there are people who work within the mental health team, can be psychiatrists, occupational therapists, pharmacists, nursing associates, prison nurse, mental health nurses, and drama therapists. Drama also supports in mental health. So, mental health nursing offers a high quality, meaningful clinical experience from nursing associates who support patient care and improve experiences of patients and carers through to registered nurses and those in advanced practice mental health nurses who have a wide range of skills that are vitally important to the running of mental health services. So, social workers are very important. We'll talk about them. So, they make a difference to individuals and families by helping them live their lives more successfully. They work with families, with the patient themselves, the elderly, the children with disabilities, the teenagers that are there, people with mental health problems, young offenders, adults with learning difficulties, mental health problems or physical disabilities. So, and the list goes on. They're refugees, they're foster carers and adopters, anyone who's facing um, a challenging situation. Social care workers can specialize in visiting clients wherever they are and assessing clients' needs, organizing support, making referrals to other services and agencies, keeping detailed records, and attending meetings. So professions with health and social care. So you have doctors, you have nurses, specialists such as endocrinologists. You have a cardiovascular surgeon, for instance. So there are different specialists as well working. So there'll be doctors, but there'll be specialist doctors, not GPs. So for by doctor we mean a GP. Healthcare workers, they're social workers and social care workers. So, what's the role of a doctor in a primary care setup? So, they can prescribe and administer treatment, they can provide follow up care for patients, refer them to other providers, liaise with other providers for and interpret their laboratory results, they can maintain knowledge, skills, and performance. Uh, they take prompt action if they think that there's a concern in the patient's safety, dignity, or comfort that is being compromised. They protect and promote the health of patients and the public. They treat patients as individuals and they should respect their dignity. They work in partnership with patients and with a lot of other organizations and with the patients' own families as well. They have to be honest and open and act with integrity, never discriminate unfairly against patients or colleagues, and never abuse their patients' trust in you and or the patient public's trust in the profession. Um, Now coming towards the role of a nurse in a primary care setup. Just as a doctor, a nurse has a lot of roles, and they most of the time they're with um, they're they're obviously involved in working with the individuals, the families, and communities so they attain, maintain, or recover optimal health and quality of life. They record medical histories and symptoms. They have the duty to collaborate with teams to plan for patient care, advocate for health and well being of patients, monitor patient health, and record signs, administer medications and treatment. They are there to operate medical equipment. They have the ability to do that, perform diagnostic tests, educate patients about management of illnesses, and provide support and advice to patients. Just like doctors, nurses also have to go through a rigorous training, and they train and further train themselves um, in order to achieve their tasks. Then we go on to specialist care within the tertiary care. So these services include a range of treatments. They're interventions that most of us have heard of, such as chemotherapy. There's radiotherapy. There's kidney dialysis, and there are a lot of others that we know about. And specialized services are not available in every hospital because they have to be delivered by a specialized team of doctors, nurses, and other health professionals who have the necessary skills and experience. Unlike most healthcare, which is planned and arranged locally, specialized services are planned nationally and regionally by the NHS England. A healthcare worker. So the healthcare worker has a responsibility to help patients to move around. They monitor the patients and performing how they perform their basic health tasks or health checks, make the patients feel comfortable in their own area of comfort. They wash and dress patients. They can serve meals and help to feed patients. So there's a wide range of services that they can provide. Then there's social worker. Um, just a minute. Okay, so I'll be teaching you till this slide, and then we will do the rest tomorrow, because then there comes regulations which will become too much for you. So a social worker is a profession, or social work is a profession that has trained professionals who are devoted to help vulnerable people and communities work through challenges that they face in everyday life. So, what their role is to promote social welfare, help people from all backgrounds overcome the individual challenges that they're facing, advocate for social and economic justice for members of diverse communities. So, they have a lot of different diverse communities that they deal with on a regular basis. Um, and they embody the social work code of ethics. So, social workers work directly with children and adolescents. There's individuals with disabilities and students. There's individuals who are experiencing poverty or homelessness, medical patients, individuals suffering from addiction, um, or mental health concerns. There's refugees and immigrants and aging individuals and couples and families. So they work with alongside all of this population. Then coming towards the last slide, which talks more about the social care workers. So they assess the client's needs, situations, strengths, and support network to determine their goals. They develop plans. So they have the provision to develop plans to improve their clients' well-being. They help clients adjust to changes and challenges in their lives, such as illness, divorce, or unemployment. They respond to crisis situations like natural disasters or child abuse, advocate for and help clients get resources that would improve their um, well-being, diagnose and treat mental, behavioral, and emotional disorders. They provide individual, group, family, and couples therapies. They assess clients' histories and backgrounds and situations to understand their needs as well as their strengths and weaknesses, and they develop a treatment plan with the client, doctors, and other healthcare professionals. That's it from my side. These few slides, we will do them tomorrow because they need more in-depth talking about. Thank you for attending this session. I'll just stop the recording of this session.